Hi, my name is Aun Ali, and I'm an addiction and trauma therapist, and I practice specifically from a trauma-informed lens. I work from both a top-down and bottom-up approach. So what that particularly means is that I work from a serogenic approach. That means looking at the client's resilience and what has helped them survive their experiences. And when it comes to a bottom-up approach, using the body to guide and kind of help them regulate in the present moment as well. जब clients को realize होता है कि the experiences that they have gone through, they've already survived them. And today is the moment in which they are just kind of becoming aware of how they have survived those experiences and what kind of benefits and not just benefits but also the resiliency it took to get to this point already. So I am certified with EMDR and also TRE. Both of these techniques are used for releasing the stress and the trauma that is stored in the body. TRE specifically helps with using the tremors that are natural to the body to release any kind of stress that might be non-verbal or might be difficult to even articulate. So all of these different pieces are used in different times during the therapeutic process, and it's done with one intention: to be of service to the client. As clients work with me and so they get to know who I am as a person as well. My facial expressions kind of go a little bit weird, so I have a very expressive face. That's something that you will notice in the therapy sessions with me. Another thing that you would know is that sometimes my questions are very kind of awkward in nature, so I kind of look up and think if a question comes up and I ask them, and all of that is done with the intention to best serve my client. I want to make sure that my questions or the way I communicate with my clients are appropriate, so I also look for a lot of feedback in my sessions. So so it's my job as the therapist to adapt my way of working to what serves the client. So I really encourage feedback in the session so that I can adjust my style to work better with the clients and how they would like to be served and helped. For therapy, for me, is a collaborative journey. It's a journey in which the client who is recognizing their resources and resiliences of how they have managed to kind of get through this experience so far that they've gone through, and also how they can appreciate their body as well, how their body is serving them. And my job as the therapist is to be very collaborative in nature and to be an observer of what they have experienced and allow them to reflectively see that as well.